Imiquimod, also known as Zyclara Cream In Packet, is a topical immunomodulator used to treat actinic keratoses, which are precancerous growths on the skin caused by too much sun exposure. Treating this condition can decrease the risk of complications from them. It is also used to treat warts on the outside of the genitals/anus. Imiquimod belongs to a group of drugs called immune response modifiers and is believed to work by helping to activate your immune system to fight these abnormal skin growths. This product is not recommended for use on children under 12 years of age unless specifically directed by your doctor. The recommended daily dosage and optimal timing for using this medication should be determined by your healthcare provider. Before using Zyclara Cream, make sure to read the patient information leaflet provided by your pharmacist. Use this medication only on the skin as directed by your doctor, usually once a day. The frequency of application depends on the skin problem being treated. For actinic keratoses, apply once a day for 2 weeks, then take a 2-week break before resuming for another 2 weeks. When treating warts, apply once a day until they clear, or for up to 8 weeks. Do not use this medication in the eyes, nose, mouth, rectum, or vagina. If it comes into contact with these areas, flush with water and talk to your doctor if irritation occurs. If using the pump, prime it before the first use. If using the packet, use a new one for each application. Use this medication regularly at the same time each day for best results. Before applying, wash your hands and the area to be treated with soap and water, then dry thoroughly. Apply just before bedtime, leaving it on for about 8 hours, then wash it off in the morning. Do not cover with bandages or other waterproof coverings. Do not bathe or wet the treated area before the prescribed application time has passed. Do not use more than prescribed or leave it on longer than prescribed. Let your doctor know if your condition doesn't improve, gets worse, or if new growths appear during treatment. When using Zyclara Cream, you may experience reactions in the treated area such as redness, swelling, itching, burning, pain, thickening of the skin, peeling, flaking, scabbing, or changes in skin color. If any of these effects persist or worsen, it is important to inform your doctor or pharmacist immediately. In some cases, severe skin reactions may occur, such as bleeding, formation of sores, blisters, or ulcers. If this happens, your doctor may temporarily stop the use of Zyclara Cream to allow the skin to heal. It's important to follow your doctor's directions in this situation. Additionally, common side effects such as headache, loss of appetite, dizziness, diarrhea, nausea, back pain, and flu-like symptoms may occur. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist promptly. It's essential to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people who use Zyclara Cream do not experience serious side effects. However, it's important to notify your doctor immediately if you experience any serious side effects, including swollen glands, new unusual skin growths, chest pain, or signs of a serious allergic reaction such as rash, itching, swelling, severe dizziness, or trouble breathing. Lastly, if you notice any other effects not listed here, it's important to contact your doctor or pharmacist for further guidance. Before starting to use Zyclara Cream, make sure to inform your doctor or pharmacist if you have any allergies to this medication or any other substances. It's important to discuss your medical history before using this cream. This medication may cause dizziness, especially when combined with alcohol or marijuana, cannabis. It's important to avoid driving, operating machinery, or doing any tasks that require full attention until you know how this medication affects you. Limit your alcohol intake and discuss your cannabis use with your doctor. Zyclara Cream may also make your skin more sensitive to the sun, so it's essential to limit your time outdoors and avoid tanning booths and sun lamps. Use sunscreen and wear protective clothing when outside, and do not apply the cream to sunburned skin. If you are using this medication for genital or anal warts, it's crucial to use effective barrier protections during sexual activity to reduce the risk of spreading the virus to your partner. Avoid any sexual contact while the cream is on your skin, as it may weaken condoms, dental dams, and diaphragms. Before undergoing any surgery, make sure to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, use this medication only if clearly needed and after discussing the risks and benefits with your doctor. It is unknown if this medication passes into breast milk, so consult your doctor before breastfeeding while using Zyclara Cream. It's important to note that Zyclara Cream may interact with other medications and could potentially cause serious side effects. It's essential to keep a list of all the products you use and share it with your doctor and pharmacist. Also, do not apply this product on the same area of skin with other Imiquimod-containing products. Always consult with your doctor before making any changes to your medication dosage. If accidentally swallowed, Zyclara Cream can be harmful. If an overdose occurs and serious symptoms like passing out or difficulty breathing are observed, it is essential to seek immediate medical attention. In the U.S., contact the local poison control center at 1-800-222-1222, and in Canada, reach out to a provincial poison control center. It is important not to share Zyclara Cream with others, as it is prescribed specifically for your condition. Be sure to keep all of your medical appointments to monitor your progress and discuss any concerns with your healthcare provider. If you forget to use the cream, apply it as soon as you remember. But if you remember the next day, just skip the missed dose. Use the next dose at the usual time in the evening. Do not use extra cream to make up for the missed dose. When storing Zyclara Cream, make sure to keep it at room temperature and avoid freezing it. Also, remember to keep the pump upright and out of reach of children and pets. When it comes to disposing of the product, do not flush it down the toilet or pour it into a drain unless instructed. Instead, properly discard it when it is expired or no longer needed. If you have any questions about the proper disposal process, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.